Hello, this is Dr. Santosh Sahanand from Ortho1. I'm the medical superintendent here and I'm specialized in knee. My specialty is knee. So what we are going to see today is about common conditions in knee. So unlike common belief, most of the common conditions are not because of injury. It's just because of overuse. We call it repetitive stress injury. It's common among all spectrum of individuals, right from kids to old age, and it's more because of excess of stress to the knee. So let's see how this happens and how this can be prevented. And this is purely a preventable condition, and it's again a curable condition, and mostly surgery or any kind of other surgical intervention is not at all required. So commonly this condition is called as anterior knee pain syndrome, which means pain in the front of the knee, or radiologically this can be called as chondromalacia patella, which is commonly can be termed as softening of the cartilage in the knee joint. And this usually happens when a particular individual changes his activity suddenly, or the intensity of activity increases, or his activity level has changed from one kind of activity to another kind of activity, or it can be something which they are doing something which they are not usually doing. For example, if they are not used to climbing steps, suddenly if they climb a temple or go for a trek without getting prepared for it, these kind of repetitive stress injuries do happen. Or it can happen in a running individual who regularly runs. When he increases the intensity, if he is preparing for a marathon, he usually goes for a 5k or a 10k, suddenly he wants to go for a 21k and he doesn't take enough preparation and suddenly does a jump of 21k suddenly within a couple of days. These kind of repetitive stress injuries can happen, which is again completely preventable. Only thing is, good preparation is required when you shift your activity level, or your activity level must remain in that level of activity which you want to do it occasionally. So this is simple things which needs to be adopted depending on what you want to do. You have to plan your activity. If you want to do something of high intensity, you should plan it about 2 months in advance. This can happen even on day-to-day basis. If you're not used to going up the bus, the steps of the bus is quite high. If you're always used to traveling in a taxi or an auto, if you suddenly try to go up the bus, these kind of pain can still happen, especially in an elderly age group. This is again preventable if you are used to keeping your knees flexible, and if you can keep your knees strong, this can be prevented. But the most important thing apart from keeping it strong is stretching. So stretching is the key in preventing this condition. Stretching is stretching of the muscles. You can do exercise to strengthen the muscle becomes stronger, but it becomes tighter also. So after every session of exercise or every session of activity, you need to get that muscle to its normal length or get its elasticity back to normal. If you don't do it over days, it keeps getting tighter and tighter. Over some days, the muscle itself can go in for soreness, it can tear, or the neighboring joints will be under high stress, and that's the reason you would get a knee pain or an ankle pain. It can present in various ways. The pain can be presented in various sites, but the basic thing which leads to this is lack of stretches. You all must be knowing warm up is important before you go to the gym, but equally important is cool down. So warm up before that activity and do cool down stretches after that activity, whatever may be the activity. This is the tip for today. Thank you very much.